how can a woman
Yeah.
self-diagnose?
Yes.
This is a very important thing, but a lot of women are not aware.
Yes. Yes.
Self-assessment,
Yes.
and are there any tests? How often they need to get it done? Can you
Right.
just highlight a bit on that?
So, very importantly, we all have heard about self-examination
Yes.
of the breast,
Yes.
that, be it of any age group, you need to examine your breast at least once or twice a month. Ideally, they say before, 5 to 7 days after you finish your periods, when your breasts are slightly more lighter.
Right.
And then you examine all the four quadrants around it in different positions, keeping your arms up on the sides, sleeping position and standing position as well, and feel for any, and your breasts well, basically.
Yes.
So you know the texture of your breast, which could be different from every lady
Yes.
to lady.
Yes.
So any changes, you would be easily able to pick it up. And also look for any skin changes, any nipple discharge that you have,
Right.
which can be sometimes be
Yes.
a harbinger of a cancer as well. So those kind of changes you look for on a microscopic level, I would say. And then consult your doctor, obviously, if you have any questions or concerns.
Don't hesitate. You
Don't
find
hesitate at
little
all.
bit of
Even
normal,
little
yes.
changes, because earlier the better.
Yes.
If we detect cancers at an early stage, it is curative.
Right. That's
So
why
that is the whole point. And obviously it's screening. So screening mammograms and ultrasounds that can be done starting age 40. Every 1 or 2 years you can repeat them, because a lot of these lesions cannot be palpated. You may not be
Yes.
able to feel it.
Yes.
And they may be picked up on certain scans.
So you see, after 40 is better. Every at least
every
3 years.
2 years, the
2 years you
guidelines
go
usually
for a
after 40,
mammogram.
after mammogram.
Yes.
And also I want to highlight that if you have family history of breast cancer, as we
Yes.
spoke about the BRCA genes, the tendency was you would need screening at an earlier age, so possibly starting even in your 20s sometimes.
Right.
And there are things like MRI and all, which will pick up these lesions better, because you'll have certain more dense breasts when you're younger.
Yes.
So a mammogram may not be enough.
MRI may be needed.
You might have to complement it with the MRI as well.
Yes. So isn't it like, if you have a family history, suppose your relative, mother, whoever, got a cancer at say 30.
Yes.
So you start screening at least 5 years before that? Is there a timeline like that?
So there is no timeline as such. Normally, if a lady was in her 20s, for example, and she knows that there is certain history in the family, and she has that high percentage risk,
Right.
and she fits into that criteria, she can start screening right away. It doesn't have to be a certain
You need not
age
wait.
at all. Exactly.
You don't have to wait, okay,
Exactly.
after 30 I will start.
No, it is nothing like that. The
The
earlier
moment
the
a breast
better.
develops,
Absolutely.
something
Earlier the
like that.
better. And I think there is high incidence of smoking in women now.
Yes.
Obesity is rising, which are all predisposing risk factors for breast cancer.
Right.
So, the earlier the better.
Always.
Earlier the better.